We'll just begin in 2 to 3 minutes. Oh, I believe everybody is here. Let's begin now. Hold on for a minute. And here we start. Okay, perfect. So now today we're going to discuss about OET Reading Part A, B, and C. So those are joint live. Those are there live. Kindly, you can just put in a hi message in the comment box so that I know that you guys are there. I'm just waiting for a few more to join, and then we start with discussions on OET Reading Part A, B, and C. Okay. Now, just hold on. I'm just letting everyone in. Perfect. So today we're going to learn something very important, something which is more focused on the strategies. Okay, that is something what we're going to discuss. So I want you to keep a book, a pen with you, so that whatever discussions we have, whatever techniques we discuss, you can write it, you can note it, because that will be useful for you when you do your practice at your place. Okay, so just another 1 minute and we begin. Okay. Perfect. Let's begin and let's keep it very simple. Okay. Now we start with part A. So we need to understand what is part A. Now in part A, many times I've seen that people do comment that we try, but we are not able to finish it in 15 minutes. Now, many times I have seen candidates, they're able to do part B and part C well. But when it comes to part A, sometimes the timing is something which they're not able to manage. The reason being why that happens, the reason is that you're not able to apply the right technique and you're not able to locate the keywords quick. So for that, we have just come up with something which is very important. So the technique is called as the 3-second grammar prediction. So there are three type of questions in part A. One is you just have to identify from which text the question or the particular given sentence is coming from, A, B, C, or D. Then you have fill in the blanks. And then you have direct questions, one word answers or two word answers. So many a times people make mistakes in those fill in the blanks. So what is the technique that you need to use when you do those fill in the blanks is this one, what I have mentioned it on the screen, the 3-second grammar prediction is a technique which will help you to understand the question well. Also, you will be able to predict what kind of answer or what kind of or what genre of word will fit in that particular blank spaces. So before looking for the answer in the passage, look at the word before the blank. It will tell you the type of word you need. So I'll just display a table. This will definitely help you. Now, many a times you can just focus on your reading. You'll understand that many a times you do this. You will see the word before the blank would be the, a, and, which can be an article. So if you see this, so you should have this. So that when the next time you do part A and before that blank space, you see any of these words, the, an article, which means your answer will be a noun. Or you see a possessive noun. Now, what is possessive noun? The word which has got apostrophe with a common noun. Like, for example, persons, apostrophe s, or patients. That's a possessive noun. So, obviously, your answer type is going to be a noun. Now, I'll also explain you what is noun, what is verb, what is adjective, so that you're very clear with it. Write this. I'm telling you, if you master this, things would be super easy for A, B, and C as well. There are only three things that you need to keep in your mind. First of all, to understand the difference between noun, verb, adjective, adverb. What is it? This is the first thing that you should be very clear in your mind. Second thing is to understand modal verbs. What is modal verbs and its role in reading? And the third thing is the technique. That is how to scan and then how to skim. If these three things you're clear, modal verbs, you should understand the strength ladder of the modal verbs, level 1, level 2, and level 3, which I taught in the previous lesson. I'll be again showing you the same slide again so that you're very clear with that. You should understand what are the modal verbs and what are its functions. This has to be clear. And then skimming and scanning technique has to be perfected so that you're able to identify the keywords quick. So these are certain techniques which we are going to learn today. So I want you to pay your attention. I want you to note down, take a book, pen, note down these things so that next time you see these words, you'll be able to at least predict within 3 seconds what type of answer you're going to see. So I'll quickly get into it. Words like the, a, or an, the answer type will be a noun, which means your answer will be a noun. Possessive nouns, if you see before the blank space, like persons or patients, it will be a noun. Words like to, quickly, slowly, obviously, the answer is going to be a verb. Verb means an action. Going, doing, coming, causing, affecting, these kind of words. Words like extremely, highly, very. If you see these words, the answer type is going to be an adjective. Adjective is nothing but which describes the verb. Okay, which describes the verb. That's adjective. Words like is, are, was, were, your answer can be noun or an adjective. Now, I'll show you in live examples. I'll show you a few questions. So you'll have a better understanding that how to apply this. Okay. So I'll go into the next slide. So this is going to be a question that we will be doing. You can put down your answers in the group, no problem. So I can see a few of the names coming up here. So you can even drop down your answers. So I'll teach you the technique how to do this. Now see this question. The question says, drugs that affect the dash can be used to reduce the level of cortisol in the body. Okay, now before even you read the question, one more thing you need to understand. Apart from noticing these words before the blank space, there is one more thing you need to be very clear in your mind is whenever you read a question, you should be able to identify the noun and verb of the question. Which are the noun words that you can see? Underline it quick. So this is your first 5 seconds rule. The moment you get the question paper, the moment you start, you read the first question, quickly identify which is the word before the blank space, because usually you'll start from the eighth question. So quickly identify which word is there before the blank space. Then identify the noun and verb of the question. Noun is nothing but the name of a place, of a person, of an animal, of a thing. It can be anything. Verb is an action. So if you look at this question, the first step that I'll do is I'll locate this word. So this is an article, the. So as per the table that I've shown you, if you have this article, the answer can be predicted as a noun. So obviously my answer is going to be the noun. So after this, what I'll do, I will read this question and I'll underline the noun and verb of this question. So what are the nouns over here? You can see drugs, level, and cortisol. These are the nouns in this question. Noun means what? Name. Drug is a common noun. Cortisol is a proper noun. So you'll underline these nouns first. Then underline the verbs. What are the verbs? Affect. Affect is an action, affecting someone. Reducing. Reducing is an action. Using is an action. So all these verbs you need to underline. So you identify in a question very quick, but see, now I'm going very slow. But when you start practicing, it should be done in 5 to 6 seconds. Quickly underline the word before the blank space, underline all the nouns, underline all the verbs, and read the question once. This should be done in 7 seconds. So keep a stopwatch and try to do these things in 7 seconds. And I'm telling you, you'll be able to do it. If I can do it, then even you can do it. We all have the same frequency, same mental strength easily. You just need to practice. Okay. So first 7 seconds rule in your part A is underline the word before the blank space and underline all the noun and verb. Now, if you read the question, then read the question once. Drug that affects the dash, okay, can be used to reduce the level of cortisol in the body. Now, understand this. Our main subject in this question is what? Something about a drug that will affect something. So, obviously, a noun, a drug which is going to affect something, which is a noun, a proper noun, can be used to reduce the level of cortisol. So, your keywords over here are two things. One is cortisol. Always your keyword would be a noun or a verb. So, the major subject over here is about the drug which affects something which can be used to reduce the level of cortisol. So my point is, whenever I scan through my part A, all the 4 texts, I should not waste my time in reading. So many of times I've seen that candidates, what they do, they read from the first line to the last line and they keep reading and finding the words. Never do that. Instead, what you do, I know my words are cortisol and medication. Search and find where all I can find cortisols. Now, for example, in this paragraph, if you see, first is my cortisol. So I can see 2 places where the cortisol is mentioned. And then my second keyword is all about the medicine. So I found out 2 places where the medicines are there. Here I'm not trying to understand anything. I'm just trying to scan and locate the keyword. I locate it quickly, underline these words, then I'll read those lines. Because I don't see any other cortisol, I don't see any other medicine or a synonym for that, because cortisol is a proper noun. Proper noun will not have a synonym. So it's easy for me to find out. So now if I read from that line where I found the first cortisol, it says high cortisol is also associated with type 2 diabetes, impaired brain function, and infections. Now, there is nothing related to my answer, drug that affect, because medication is not there. So the next line where I can see medication can be taken to reduce the production of cortisol. Medication. So my question was what? Using a particular type of medication can reduce the level of cortisol, but that will affect something else. So my keyword is also affect. So I'll read further. What does it say? Such medication affects the adrenal gland and include metapyrin and myostatin. What was my question? I was talking about a drug which could affect something in my body, because my last word of my question is in the body. So I'm talking about something, a proper noun, and of a drug which can affect something in my body. So what can be the answer? You can type in your chat box if you are free and if you really understood. So you can just put in your chat box. You can try. What can be the answer? I'll just give you 10 seconds. You can try. Perfect. Perfect. Simple. The answer is a medication that affects. Now you can see the word article before the blank space and a word prior to that, you can see the word affect. And exactly the same keyword, you'll find it in the paragraph as well. Such medication affects the adrenal gland. So the correct answer over here is adrenal gland. So don't forget the 3-second prediction, the grammar prediction tip. Next time when you're doing your part A, 6 seconds, what you have to go in step. And if you follow this, I'm telling you, it's going to be super easy. What you do is underline the article or whatever is the word before the blank space, first step. Second step, underline all the keywords, noun and verb in a question. Don't try to understand. Third step, read the question once to have an understanding. Then jump into the paragraph and locate the keyword wherever you find, because now I'm showing you directly the text. In the examination, you have 4 texts. So you have to scan quick and find out in which paragraph will I get this keyword. And also there is another trick, like you just scan through each and every text one by one quickly to understand the heading of that particular text. So that when you read a question, you'll be able to understand if I'm reading about a physiological effect, I should go to the first paragraph. If I'm talking about the medicine, I should go to the second. If you understand the gist of the paragraph. But we only have 50 seconds for each question. So do not waste your time. Very important. Okay. Now let's go to the second question. Same technique. Question says, stress hormones activate the dash. causing IBS. So what will I do? First of all, I'll locate the word before my blank space. My blank space, there is an article. So obviously my answer is going to be a noun again. And before that, I can see the words like stress hormone activates. I'll quickly underline the noun and verb. Stress hormone is a noun. IBS, which is irritable bowel syndrome, is a disease condition name. So IBS symptoms and stress hormone, these are my nouns. What are my verbs? Verbs are nothing but action words. Something which causes, something which make things happen. That's an action. So the verb is causing and activate. So keep my four things in my word: stress hormone, IBS symptoms, activate, and causing or become. Now, what I'll do, I'll read the question. Stress hormones activate the dash, causing IBS symptoms to become more prevalent. Prevalent means heightened or common. Okay, something which increases these symptoms. Stress hormones, which is my noun, activate something. So these are my keywords. What I'll do, I'll quickly go and locate, can I find something which is related to stress hormone, which is related to IBS, and which is related to activating. So I'll just scan, I'll not read anything. I'll scan and try to find these words. So I'll quickly see, I will find IBS symptoms, which is over here, stress hormones are over here. Now I just need to find something related to activating. So wherever I found the keyword, I'll start reading from there. IBS symptoms can be made worse by stress. But that doesn't give me my answer because my answer is stress hormone. Next line says stress affects the immune system, which directly affects the gas. Nothing related to me. This is because once activated, yes, bingo, I got a word which is matching with my question, activated. Second word, stress hormones. I could match it. Okay, I found activated. I found stress hormones. Now I have to find out what has been activated. So if you read it, it is a little tricky. Sometimes people don't understand it. Every time it will not be given in an order or in a line. Every time that is not going to happen. Because if you read this, you see, this is because once activated by stress hormones. Now this bracket, what is given stress hormones, is actually a distractor because I'm explaining, you will understand. But when you do it by yourself, people who are very good with reading, definitely you'll be able to ace it. But if you're a beginner and you're not that good with reading, so this will distract you. This is because once activated, now remove that bracket. Forget that bracket, it's not there. Ignore it. And if you read the full line, this is because once activated, the immune system causes inflammation throughout the GI tract, causing cramping and a change in stool consistency. What do you understand? It is not directly given that this is because stress hormone activates the immune system. Not directly, it is not mentioning that. It is just bypassing that because of this brackets what is given. This is because once activated, comma, the immune system causes inflammation throughout the GI tract, causing cramping and changing in stool consistency. So what it is activating? Anyone, you can give a try. If you understood this, you can just write it. I'll just check the message. Yes. You can just comment your answers. Yes. What do you feel? What can be the answer over here? Yes, you can write it. Stress hormone is activating something. So what does it activate? It clearly says this is because once activated, the immune system, so it is activating what? It is activating immune system. Because if you see over here, it clearly says once activated, the immune system causes. So what is activated over here? What is the subject? The subject is immune system. Because of the stress hormones, the immune system gets activated. That causes inflammation throughout the GI tract. So the correct answer over here is immune system. Simple. Very good. Yes. Good. Keep, yes, very good. Keep commenting. Make sure that you be active in the chat box, which I get to know that who all are attending. And are you able to understand this? So the answer over here is immune system. And after the lecture, once we are done, please let me know if this is productive for you so that I keep continuing to continue such kind of lessons for you. So this is an additional lesson that I'm giving you on every Saturday. So I'll ensure that I'll come up with new lessons, new training, new learnings. So if you're enjoying it, put a thumbs up in the group or in the chat box. So I get to know that you are learning something from this. Now, the next thing. Now, always I've told you when you do your part A, so don't stick to one technique. So technique is like you underline the noun or you underline the verb. You should also see if I have more amount of verbs in my question, it is very easy question. I should not spend more than 30 seconds to find answer for that. If you look at this question, the first thing, as I told you, you will have to find out which is the word there just before the blank. So I can see it's a possessive noun. Persons, possessive noun. Someone's, it belongs to someone. So usually the answer is going to be a noun, or it can be related to a verb as well. Okay, but usually 99% of the time when there is a possessive noun, apostrophe s, persons, patience, apostrophe s, the answer is going to be a verb which is related to that particular person. Okay, now what I'll do, I'll quickly see what all kind of words are there. What are the nouns over here? I can quickly see the nouns are very less, people and person, nothing else. But I can see a lot of verbs. What did I tell you? Verb means what? Action. Verb means action. Biting nails, that's an action. Being restless, action. Drinking, action. Smoking, action. All these ing words. Getting angry, that's an action. So I can see a lot of verbs over here. So my job is pretty easy. Ask me how. What you need to do, you just need to find out these verbs, and finding these verbs would be super easy. But these verbs may have a synonym, you'll have to be a little careful. So if you look into this paragraph quickly, you'll understand everything is over here. I can see biting the nails, I can see experiencing restlessness, I can see drink, smoke, snap at people. Snap at people means getting snapped, angry. Snap at people. So see, snap is a synonym for angry. So they can use synonyms as well. You should be careful unless it is a proper noun. Okay, so be very careful. So it says biting nails, being restless, drinking or smoking, as well as getting angry at people are few examples of how stress can impact a person's dash. So now, I did not get to my answer. What did I do? I just tried to locate where exactly my keywords are. Those are these verbs. Then once I found out, I need to underline, okay, this is the line where I have all my keywords. What I'll do, I'll find the nearest punctuation. Where did the sentence begin from? So if you look at this, it says to add to this, stress can affect a person's. Oh, I got an exact match of my word just before the blank space. Person's what? Answer is, you can put in the chat box if you get it. Answer is behavior. Clear? So this is how easy it is. Once you start believing that I know the techniques how to ace it, once you start believing that I can do it easily, you will see that your brain starts aligning your practice in that way. And you will see that you are able to align yourself to locate answers more quicker. Because I had candidates who were like super weak. But after 25 to 30 days of regular practice, they were able to ace it. They were able to locate it. You need to practice to move your eyeballs quick, you move your focus quick, move your sight quick, ensure, see quick, and locate it and lock the context. Wherever you found it, underline, lock the context. Then read that particular line, you'll get your answers. But the preparation and the strategy has to be correct. Ensure you know which is the word which is there before the blank space, so I can expect a noun or a verb. What kind of answer I'm going to get it. Then look for noun and verb of your question. Then try to locate them in the paragraph quick. Once you locate it, ensure that you read from the nearest punctuation, you get the answer. This is the only technique which works. And I'm telling you, if you keep a habit of reading, things would be super easy for you. Let's go for the next one. Quick, same technique. Now, this is not about the fill in the blank. This is about the direct question. Same technique, nothing. Only one thing changes over here. Since we don't have any blank space, we don't have a word before the blank space. Rest, noun, verb, location, everything is going to be the same. But you need to also ensure there is something called as modal verbs. May, might, should, shall, will, must, however. These words has got the certainty to change the meaning of the sentence. So you need to be very careful whether a reading sentence has got a modal verb. You will have to decide whether it is an obligation, whether it is a recommendation, or is it something which says that inconsistent or unsure of. So you'll have to understand this. So I'm going to the next slide. I'm going to show you the strength ladder. Now the question says, apart from reduced brain functioning and infections, which condition is associated with high cortisol? Quickly underline the nouns. What all are the nouns? Brain, Functioning has got ing, so obviously that's a verb. Brain, infections, high cortisol. So my keywords are very clear. My keywords for nouns are cortisol, brain, and infections. And my verbs are reduce brain function is associated with. So what I'm going, then I'll read the question. Apart from reducing brain function and infection, apart from these two conditions, which condition is associated with high cortisol? What are my keywords? High cortisol, brain, and infection. Okay. Once I find this high cortisol, brain, and infection, I just have to find the third condition which is associated with high cortisol. Wherever I would find the brain functioning and infections, near to that, I'll find my third condition. So I'll have to quickly locate where is the word high cortisol. So if you read this carefully, if you look at this carefully, you'll understand. I found my keywords over here, brain function. I found infections. Now I will find the nearest punctuation. Where does this line begins from? So the line begins from high cortisol, which is also my keyword. High cortisol is associated with type 2 diabetes, impaired brain function, and infection. My question is, apart from brain function and infection, which is my third condition? I got it. My third condition is type 2 diabetes because it clearly tells me that it gives me three conditions. I just had to find my third condition. So the correct answer over here was type 2 diabetes. I hope everyone, those who are attending, you're able to follow your understanding. Now let's go to part B. Okay, no, not part B. We're still on part A. One more question will do. Now I just wanted to show you something. Even with some common nouns, they can also use synonyms. So you should understand. Now, if you read this question, in addition to the arms and legs, which area of the body is most likely to be affected by chronic plaque psoriasis? So you need to understand which is my proper noun over here. You'll have to understand which is my proper noun. In addition to arms and legs, obviously that's a common noun. Which area of the body is a noun, is most likely to be affected as a verb, by chronic plague, that's a diagnosis, name of a disease condition. So obviously that becomes my key word. That becomes my key word, which I need to find it in the paragraph. So that's my noun and the verb is affected. So I'll quickly go into the paragraph and try to find where is this word. So I found this word in the second line. Okay, it says chronic plague psoriasis. Okay, so what I'll do, I'll find the nearest, that is the first line itself. Diagnosis of cutaneous psoriasis is usually straightforward based on the clinical appearance. And no, that is not it. We'll start from here. Frequent presentation is chronic plague psoriasis and is characterized by well demarcated bright red plaques covered by adherent silvery white scales. What is my question? You have to keep your question very clear. I don't want to find what are the characteristics of this disease condition. I just want to find, in addition to arms and legs, which other part of the body is likely to be affected. So I just have to find a body part. So that has to be clear in your mind after reading the question. What am I going to find? I'm going to find the third body part apart from arms and legs. What does the next line says? These may affect any body side. May. We don't know which one. Any body side, often symmetrically, especially the scalp and extensor surfaces of limbs. Now they are saying limbs. If you look for the word arms and legs, where is arms and legs? You will not get it anywhere. And then you'll be like, oh, George taught me something about keywords. I did not find it. No, you did not understand it. Limbs. What do you mean by limbs? Upper limbs and lower limbs. That includes your arms and legs. So that's a synonym that has been used. So which is the other part of the body which is along with those limbs? That is the scalp. So the correct answer over here is scalp. I hope you're learning something from this. So keep this in mind. Underlining the keywords and locating the keywords are the key if you want to ace your part A. Now, these are the model strength ladder. So if you have a book and pen, you can write it. Now, words like must, have to, need to, must not, cannot, or will, which talks about strong obligations. You will have to do it. There is no second option. If you find these words in your options, which means that option is telling you it's an obligation. A person has to do this. There is no option. If you see words like should, Ought to or should not, which stands for an advice or a recommendation. You should. However, you shall. However, you ought to. Or however, you should not. If you see these words, which means author is giving you an advice or a recommendation or an opinion. He's not obligating that on you. He's not putting that on you saying that you have to do it. He's just giving his advice. It's up to you. And the last one is possibility. Words like may, might, could, can, would, or shall. Also, you will find some contradictory words. Words like however, although. Whenever you find these words in your part B and part C, 90% of the times the answers are near to these words, however and although. Be very careful. However, although, yet. There is one more word I did not add here. You can write in your book words like yet, Y-E-T, yet. If you find these words, ensure you read that line carefully. Usually answers are nearby to that. Now we are jumping into part B. Okay. Now I've set a timer as well. The first minute is the key. In 1 minute, your understanding should be clear about the question and the paragraph. Okay. And how to do part B is QTO method. It's a proven method for acing your part B and part C. Q stands for question, T stands for text, and O stands for option. QTO. First, read the question, underline the keywords. Keywords are nothing but noun and verb. By now, it should play in your mind next time when you do your reading text. Noun and verb. This email about smoking cessation tells hospital staff that they. So, email is about what? Smoking cessation. That's my keyword. Telling the hospital staff that they should do something. So I have to find out this given email, which is there in front of you, what does it tells you about smoking cessation? Find a general understanding within 1 minute. Then you have 1 minute to find out the correct answer. So I'll start the timer and I'll be with you. Okay, now we have 1 minute. So I'll quickly find out where is smoking cessation. I can see at 3 places the smoking cessations are there. The first place, I'll read it from the punctuation. What does it say? Smoker in hospital are often motivated to quit due to concerns about their health, and most are receptive to smoking cessation advice from hospital staff. So most of the smokers are receptive. They are able to understand. They listen to these people who are from healthcare professionals, whatever advice they give. So this is not my question. So I'll see one more wherever I find the word smoking cessation. I can find in the second last line. What does it say? Interventions are delivered by busy clinicians in addition to their existing patient care responsibilities, and many feel that the discussing smoking cessation is not part of their role. What did I understood? Two things I understood. First thing was I understood whenever a hospital staff gives the advice, they listen to it. Second one, the staff feel that this is not my job. And the last one says, however, as I told you, however, smoking cessation support, however, is a word where the change happens. So the author is trying to recommend something. What does he say? However, smoking cessation support is the responsibility of all clinical staff. So this is an email. At the end of the email, they are trying to give you an idea or give you an opinion. My first option says must familiarize. What do you mean by must familiarize themselves with ways of helping patients? That's an obligation. But however, the author is just putting an advice. It's just a recommendation. Will support or will receive more support in dealing with certain patients. I did not read anything about certain patients. Wherever I found smoking cessation, it was all about giving advices. It was about staff. It was about staff's attitude towards giving this advice. And the last one was an advice. And the C option says should take time to talk to patients about the issue. So that is an advice. That's a recommendation. Why? Because there is a modal verb should. And should stands for recommendation. What does the last line say? Smoking cessation support is the responsibility of clinical staff. Which means what the advice is all about, even though you feel that's not part of your role, that's your responsibility. So you should take some time to talk to the patient about the issue. So it's your responsibility to talk to them. You cannot ignore it. So that's the reason the first two gets eliminated. Since there is an advice given by the author and the question is all about, the email about smoking cessation is telling. Telling means what? Advising. So the question is itself is all about what is that advice. So obviously your answer is also going to be something related to an advice, and should stands for advice. So that's the reason the correct answer over here is C. So you need to be very careful with modal verbs. If you understand the modal verbs well, and one more technique is like this, however, although, yet, if you find these words near to any sentences, usually your answers are nearby to this word. And so, hence, wherever you find this word, read that sentence carefully, you will get the correct answer. The correct answer over here is C. If you have any questions, you can just put in the chat box. If you need any explanation back again, you can put it for the question. I will ensure I'll explain that again to you. I really don't mind. Okay, perfect. So my chat box is open. So if you have any questions, you can put it there. I'll be happy to answer that. Perfect, perfect. Immune system. Good, good. Keep answering. Very good. Vaishali, Sonam. I can see many people. Good. Next one. You can see a paragraph. You can see a question. Now, the main point of the section of guideline is so many a times you'll get this question. What is the main point? If you get this in part B, you should be very careful. It's very easy to understand what is the main discussion. Usually these kind of questions will have two paragraphs. Most of the time, 60 to 70% of the times with all the questions I've seen that you have two paragraphs. One paragraph will be all about a different topic, and the bigger paragraph will be all about that one single topic. So that is how we understand what is the main idea of that particular given text. So if you look at here, you can see the first para is all about clear oral fluid should be actively encouraged up to 2 hours prior to the surgery. This should be considered mandatory in the very old and very young, those in hot environments. And the second one is all about what are the deadlines and all those things. And you can see this is the bigger para. So obviously, whatever is discussed in this bigger para is going to be about your main point. So your idea will be very clear that this is where I need to focus. So now I'll play the timer and we'll do it together. Main point. So what do you have to read? You'll have to read it carefully the second. So you will also have to locate if there is any kind of modal verbs given. After the 2 hour deadline for free fluids and right up to the time of surgery, a nurse may still give the patient 30 ml of still water. This may be either for the patient's comfort, should the patient request if unprompted, or to allow the swallowing of any prescribed medication that were not able to be taken before the 2 hour deadline. Maximum allowed is 30 ml of water. Concession must not means it's an obligation. Concession must not be taken as allowing the patient free access to water, as exceeding 30 ml of hour of water so close to surgery could delay the operation. So what is it all about? It is all about what is the amount of fluid that you can give the patient before the surgery, right? There is an obligation. The concession must not be taken as allowing the patient. So it is not for a particular patient, like young patient, elder patient. No, it's for all the patients. There is an obligation. If you understand the modal verb or modal word strength ladder, next time when you read it, you'll understand whether it is a confirmed statement or an unconfirmed statement, whether there is a doubt in the certainty. You won't have that. Okay. So if you read the options now carefully, you will understand. Explain why patient should consume fluid before surgery. Is that the main point? That is there in my first 3 lines. But my bigger paragraph is all about when to restrict. Confirm, second option says confirm which patients are allowed to have fluids before surgery. There is no condition on that. The concession must not be taken as allowing the patient free access. So for all the patients, it's going to be the same. There is no particular set of patients. C says specify the quantity of fluid that patient may have before surgery. May have. You will find the same modal verb in the paragraph as well. Specify the quantity of fluid that patient may. You may give, maximum is 30. So the correct answer over here is C. Clear? Within 2 minutes, you should be able to do it. So next time you sit for it, even if you may be working right now, you might have been passively listening to this lesson. Very clear. Next time when you sit your practice, underline the keywords. Keep in your mind about the modal verbs. If you are able to ace it, like you keep on doing it, you make mistakes and do it, and then you identify the modal verbs, you will ace this technique. And once you ace this technique, you will find part B and part C super easy. I have seen candidates doing it. That's the reason I'm telling you. Now let's move on to a part C question. This is the last one we'll do. And I hope, and after this lecture, I hope this was helpful for you. And after this lecture, if you're free, I would recommend you to open up a part B and part C, maybe the difficult one. Any book or whichever text you have, open it and ensure read it once. and see out of 6 questions in part B, how many answers you get correct. Or out of 16 questions in part C, how many you get correct. Now, this is a part C question. Same technique. Keyword. Keyword is the key to ace your part B and part C. And you should be able to locate it. Now, what does the question say is, and the method, QTO, okay? Question, text, and options. Don't read the options first. If you read options first, you will end up matching words. The moment you get a word matching to your paragraph, you'll say, oh, this is my answer. No, 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 no. They will play with model verbs. Now, question says, how does Zeshan Sayyed feel about using ML in healthcare? Now, first of all, when you read this question, the first thing should come in your mind, I need to find what is ML. ML stands for, in the second line, it says machine learning. Then read the question again. How does Zeshan Sayyed feel about using machine learning in healthcare? I don't want to know what others feel about it. I don't want to know what the author of this particular letter feels about it. My question is about my keyword, that is Zeshan Sayyed. That's my keyword. That's my noun. So keep that in your mind and then read your paragraph. What does it say about Zeshan Sayyed? So I need to first look at where is Zeshan Sayyed. I've underlined it, but I've highlighted it. Said Zeshan Sayyed, who directs Stanford University Clinical Interference Algorithm. Now I need to find what did he say. So I'll have to read from where the sentence began. I'll have to find the nearest punctuation from my keyword. My nearest beginning punctuation is from after the full stop of inevitable. You can see after years of experimentation, its predictive powers are well established, which means what? After years of experimenting, the predictive powers of machine learning, how well they can predict the future, are well established, which means he feels it's well known, it's well proven. And it is poised. Poised means position to move into broad real world applications, which means what? He's confident. Zeshan said he's confident that after years of experimentation, its predictive powers are well established and it is ready to move into the real world application. That's what he feels. Now, many times what happens, people read it the next line as well. They do that over smartness to understand. See what this paragraph is telling. So they read the next line. The implication of ML are profound, he said, yet it also promises to be unpredictable. Okay. When he said the implication of ML are profound, he said, full stop. Done. Whatever he said is done. Now, this is an author's opinion which is coming in an inverted comma. Yet it also promises to be unpredictable, disruptive flows, likely to alter the way doctors make medical decisions. So it is not negative. It has been said it is an unpredictable force. Likely, not sure. Likely to alter the way doctors make medical. The way doctors make the decisions, the machine learning won't make it. It will be super quick. Doctors may take some time. But when a candidate reads it, whenever I did this question with any of my candidates, the answer that came to me was always D. Concerned that it will cause more problem than it solves, because they read some words like unpredictable, disruptive force. They feel something is negative. So this is how distractors play with you. You don't have to get into it. Wherever you found your keyword, stick to that. Lock the context. When you lock the context, you won't be distracted. When you don't lock the context, you get distracted and you end up choosing the wrong answer. You got a keyword, keep yourself disciplined that I'll not get distracted. I got my keyword, I'll read that particular line to understand what does my keyword say. So what does the keyword say? You can just, if you have found out the answer, I eliminated already one that was concerned that it will cause more problem than it solves. That is D. Now we have A, B, and C. Can anyone tell me what can be the answer? You can just put it in the group. Not in the group, I would say in the chat box. And if you're really learning something from this lesson, please ensure share this video with someone who is preparing for OET, or you can put a thumbs up in the chat box so that we understand you are enjoying these type of lessons and these are teaching you something. Or you can put a comment on our videos, forward this channel to your friends who are preparing for OET. It's free learning. for everyone. This is an additional lesson what we conduct for everyone. Those who are students, those who are not our students, for everyone. So ensure, share it with someone who will be benefited from this. My aim is to just benefit others. So someone should be benefited from it. And if you really like this lessons, you're learning something, please ensure put in a thumbs up on the comment box. And now you can write your answers as well. What do you feel? What can be the answer? He's confident. Yes, I already started getting answers. He's confident about it, right? Because he feels it's well established. He feels it's positioned to move into broad real world applications. So first option says relieved that it has finally been accepted for use. He is not relieved. He's very sure about it because it is after years of experimentation. There was no doubt about this in this paragraph. Unsure about its reception by medical professionals. No, nowhere the medical professionals are resenting it or they are not rejecting it. So even that is not an answer. And as I told you, D is not an answer. C is the correct answer over here. Okay, guys, that's all for today. I believe you have learned something. I've taken around 40-45 minutes. I believe you've learned something. Even next week, I may come up with a writing lesson. I may come up with something new, which you might have not learned in our regular lessons. I'll ensure that I'll keep teaching you. I want you to ace your OET in your first attempt. If any doubt, any questions, my phone numbers are given in the description as well as on the screen. You can call me anytime. The first number is my direct number. So you can call me anytime. I'll be there to help. Thank you so much for joining in. Have a beautiful evening ahead, guys.